Yes.
How would you go about like, like gaining more respect for the profession itself? Because I know that in some like instances there's a lot of like disrespect in that aspect.
Um, I think it's part of the world we're living in now. I, it's not just pharmacy. I think we see a general disrespect going on in terms of, the clerk that's waiting on us. It could be the physician, anybody. I think it's just one, how we treat other people. It will be reflected back to us. So if you treat people well, then they will treat you well for the most part.
Good
I
morning,
see.
everybody. Good morning, good morning. Good morning, Dr. Hilliard. Thank you for
Yeah,
joining us. I see you're already answering questions.
we're just killing time here.
Killing time. I just made you co-host, so you'll be able to share your screen. And I think we will go ahead and get started. So you guys are in for a treat today. I am so excited to introduce Dr. Nicki Hilliard. She is a professor of pharmacy practice at the UAMS College of Pharmacy. She has pharmacy practice experience in community, independent and chain pharmacies, and free medical clinics, but has focused most of her career to be an innovative educator of nuclear pharmacy practice and management. Dr. Hilliard has expertise in interprofessional education, online learning, and education and technology, having started and managed the Nuclear Education Online Program, which has trained thousands of nuclear pharmacy and medicine personnel across the nation. Dr. Hilliard is a very active volunteer, definitely so, in leadership, having served at the APHA, so that's the American Pharmacists Association, national president and trustee, and APHA APPM president, APHA governmental affairs, strategic planning and policy standing committees, and chair of the Board of Pharmacy Specialties Council on Nuclear Pharmacy Practice. She recently joined the staff at the Arkansas Pharmacists Association as director of professional affairs. And what I can tell you is, if you know Dr. Hilliard for any length of time, there is going to be a time that you get a little message and a nudge from her to be active in the profession. She's gotten me several times. And so I definitely appreciate that part of her. She is definitely one of the biggest proponents I know for pharmacy and involvement in your profession. So without further ado, I will turn you guys over to Dr. Hilliard. Dr. Hilliard, these guys are super active in the chat, and so keep an eye on that as well, and they typically have questions for you. So thank you for being here with us. We appreciate it, and you guys enjoy.
Okay, great. Thanks, Dr. White, for those kind words. And she's equally involved with the profession, and so you can learn a lot from her as well. She's can point you in the right way. I will put in a plug for making sure that you are engaged in the profession, and one of the best ways to do it is join your professional organizations. Make sure that not only now in school, but throughout your career, that you are a member of the Arkansas Pharmacists Association or your state association and a national association. I think it's part of your professional ethics to support the profession and to make sure that we have a strong profession. So I'll put that plug in to begin with. So I'm going to do something different that I've never done before. I've been teaching for, at UAMS for almost 30 years, but I'm also very techie and I like to use some of the new tools that we have. And so has anybody been using Menti with y'all? Okay, so we're going to do that today, so you can get out your cell phone, because we're going to get started with that. So if you'll go to menti.com, let me pull up share my screen with you. Okay, and okay, so hopefully this all works. If you will go to menti.com and put in some words that you would use to describe pharmacy school. So we're just going to start with just a general question to make sure that y'all are very good. At least we've got an answer there. So I'll let y'all, you can put in like at least 3 words if you want. Give you a little bit more time to make sure that you're logged in. All right. Thank you for those words. And I did put in the filter for profanity, so hopefully didn't have too many of those words, but I see challenging is one of the, the main words. Stressful, overwhelming. Absolutely. I went through pharmacy school. But I also see on here, it will be worth it. And absolutely anything worth having is worth working for. So absolutely, there's so much information. I know you feel like you're drinking out of a fire hose sometimes. And, and as hard as it is, there will be challenges throughout your career. And that's one of the things we're going to talk about is professional ethics, because you will be facing challenges in ethical decisions, and we're going to talk about how you might deal with those. So great, thanks for joining in on that. So anyway, so I just sort of picked out a picture to go in this, but it's one of the threads of our profession is the different ways that we can have to navigate professional decision making. So I'll throw this question out to you. What are words that are synonymous with ethics? I think y'all are perfectly on track here. That's the words coming in. And sometimes ethics is hard to define because there's not a clear line, but we kind of have a nebulous feeling if it's the moral decision, doing what's right, being honest, having principles, having integrity, absolutely all of those. And they're very important characteristics of the profession of a pharmacist, for sure. Okay. As Dr. White mentioned, I was president of the American Pharmacists Association. I just thought I would throw this in and show you, this is the building in Washington, D.C. It's the only non-governmental building on the mall of the Capitol. And it actually faces the Lincoln Memorial, the lawn of the Lincoln Memorial, straight across. And so it's a beautiful building. It has been here for a number of years. They recently added on the building behind the white structure. And then we also rent space to the State Department. And so that helps, actually, the money that we use for rent actually spins off. It's our strategic opportunity fund, the opportunity to invest in new projects and hopefully expand and advance the profession. And so it was a very wise investment. So anyway, I just wanted to show you this because it reminded me of ethics, because when you go inside this door right in front of you, you'll be in the rotunda. And this is a picture of inside the rotunda. And actually, this is a statue of William Proctor, who's considered the father of American pharmacy. And actually, when you're in the build, if you get to go to the building, you need to rub his boot because it's supposed to bring you good luck on your NAPLEX exams. Anyway. But what he's doing is across this rotunda on the other side, I don't have a good picture of it, but I took a picture of, it's a big marble plaque. It's about 6 feet tall, and it's the code of ethics for the pharmacists. And so that is in the rotunda, and it's one of our important keystone elements of the room. So the code of ethics for the pharmacists are respect the covenantal relationship between the patient and the pharmacist, promote the good in every the good of every patient in a caring, compassionate, and confidential manner. Of course, that leads us to HIPAA issues as well. Respect the autonomy and dignity of each patient. Patient confidentiality is, in both of the second and third ones. Act with honesty and integrity in professional relationships. Maintain professional competence. Respect the values and abilities of colleagues and other health professionals. Serve individual, community, and societal needs, which right now in a pandemic, pharmacists are right at the forefront of that. And seek justice in the distribution of health resources, which is a challenge these days because we do have a lot of disparities. But these are the code of ethics that have been adopted by the profession. And in fact, when I was president, somebody brought up the issue of, should we revisit this? Should this be changed? And we had a task force that looked at it as well. I made some minor modifications, but it has to be taken to the membership to see if we want to vote to change those. But they just tweaked them a little bit. It hasn't been voted on yet.
Okay, I'm sorry, I asked in the chat, when were those specific codes established?
The last time it was updated was 1994, I think. So they wanted to just take another look at it to see if there's anything we might want to change. I don't remember when the original ones came out, but I just know that the last time it was evaluated it's been a while. Yeah.
Thank you.
Okay. All right, so here's a quiz for you. Here's a case study. Anyway, one of the things about ethics is because it's sort of hard to define, because one of the reasons is because each person has their own view of things. And so what might be ethical for one person might be seen differently by another person. So here's a situation where, say, a California fire evacuee comes into your pharmacy near the closing time. She is staying with family, and she's lost her prescription for diabetes during the evacuation. She would like to pay cash for a week's worth of medication. Would you give it to her? So somebody want to answer what they would do? You don't have a written prescription. You can't get a hold of her physician.
So the first thing that comes to mind to remain ethical is to find out what kind of medication it is. Like if it's an insulin and there's something comparable that doesn't require a prescription, maybe I could help her figure out, that. But laws do, like, even though my ethics say, of course I want to help this person, or my morals say, I want to help this person. She's in a place where she needs help and I want to be able to provide that. Without a prescription, I don't feel like I could give her, even if maybe she had a bottle, but she lost it, without contacting someone, getting a prescription, I still couldn't give her medicine. I couldn't give her a prescription medication.
Well, I will tell you that at one point the law said that you could not because you didn't have that. But sometimes you just have to use your professional judgment and do what's best for the patient. And sorry if you're hearing background noise, the yard people decided to come in right now. But actually in Arkansas, after Katrina happened and all those different things that have happened with hurricane evacuees as well, and because sometimes you can't get a hold of a doctor if you don't have a refill, but they're on, say, maintenance medication for diabetes or hypertension. As a pharmacist, you can use your professional judgment. You can fill a prescription with up to 30 days of, you can refill a prescription for 30 days, or you can help these people out in this situation. So yes, you can do this legally, and you should be able to help these people. So you have to use your professional judgment. And, if she says, I'm taking metformin, she knows exactly what she's taking, and you don't want her to be without. She's in a dire situation. You can do that. This is legal to do. It's in 2017 is when they passed the rule in Arkansas that says pharmacists can give up to 30 days refill without checking with the doctor.
So I do have a question.
Sure.
Do we, like, I guess we haven't really talked about laws very much at all.
Mm-hmm.
Not at all. Zero, as far as I remember. Would it be us writing her a prescription ourselves for one 30-day supply? Or like, how would it even work?
Well, a lot of times they may have their bottles with them or something, and you can see everything that's on there in the doctor or whatever. But yes, you're basically saying, well, what's your doctor's name? And you're going to give that prescription to them to make sure that they're not without. So right now you're not breaking the law. I can tell you, when I worked in community pharmacy right out of pharmacy school, there were plenty of times when you kind of had to bend the law a little bit. People would come in and they didn't have any refills, and it's on a Saturday and they can't get a hold of their doctor. I remember one time I used to work relief at a pharmacy, and I was working at a drugstore in Cabot that's no longer open. And somebody came in for a refill, and I realized they haven't had a new prescription in ages. And so I called on it and actually found out that the physician had died, and that and I only gave them like a week's worth or something, and told them they had to get a new prescription. But I couldn't just say, nope, sorry, can't help you. You have to be without your medicine for a week. That's just not right, because you just have to make sure that people have continuity of care. Now, we'll turn this around a little bit, a different slant, the same sort of story, but they come in near closing time, same thing, but she wants hydrocodone instead of her diabetes medicine, metformin. So what are you going to do there? She still wants to pay cash and get a week's worth. That's a little bit different scenario, and sometimes you still need to use your professional judgment, but I will tell you the law says you can't give hydrocodone in this situation because it says you can refill up to a month's worth except for narcotics. And I will tell you, people can look very legitimate, and they will tell you all these sob stories trying to get medicines. That's just one of the things you're going to have to guard against. And it's hard to find out sometimes who is telling the truth and who's not telling the truth. But in this case, you could pull back and say, well, the law says I can't do narcotics. I could do other things, but not narcotics. Yes.
You said specifically the word narcotic. So controlled substances 3 through 5 are those are those in that class? Okay.
Yeah, controlled substances. Yeah, thank you for that clarification. I know there. Yeah, another question.
So at that point, I mean, what would you just basically if they did seem legit, would you just basically suggest them to run to urgent care real quick or something?
Yes.
Okay.
Yeah. I mean, it may be a patient that has a sickle cell crisis, and absolutely they need pain medication. Yes, you would refer them to urgent care. You may refer them to the emergency room if they need it. But it puts you in a difficult situation, but at that point you probably would refer them. If they need hydrocodone, if they're really in that much pain, they probably need to see somebody. Okay. All right. This is called the Georgetown Mantra. Basically, these are the 4 principles of ethics. One is benevolence, is to do what's good for the patient. Put the patient's interest, at the forefront of your decision-making process. The other one is non-malfeasance. Do no harm. You've heard that, the physicians mantra also is, at first, do no harm. Don't make it any worse than what it is. So, and those two are two overriding principles on ethics. Another one is justice, to seek what's best for the patient. And then sometimes when you have to weigh, sometimes you can do what's good for one group might be not good for another group. And sometimes you have to weigh what's the best overall. And then also justice and what's best for society, things like that. But at first, you really do want to put a person's interests at heart. And autonomy is very important too. Protect the wholeness of the patient and honor his or her capacity to choose care options. Now, there will be times in medicine where the patient will make the wrong decisions. They may not have all the information, or even if they have the information, they've been told, they do not choose what you think is the right decision. They say, well, I'm not going to go through chemotherapy, or I'm not going to take this life-saving drug for whatever reason, or I'm not going to take this vaccine. It is their decision, and period. That's where it stops. If they say no, the answer is no. If you go ahead and do a procedure or give them drugs that they don't agree with, that is just one of the principles that you just don't do. That's one of the ethics. So you have to respect their decision, even if you think it's wrong. So you respect the patient's autonomy. I know personally, the anti-vaxxers drive me crazy. But it is their decision. I can't make them have it. You know, do I think vaccines should be mandatory in some situations? Absolutely, I do. You know, at UAMS, everybody has to have a flu vaccine. Not only protects us, it protects our patients, and it protects public health. We've got a pandemic going on. We've got 30% of patients that said they're not going to get a vaccine. And even when it comes out. And to me, that's just mind-boggling that they won't do that, even though there may be something life-saving. But it is their decision. I think as a health professional, we can only use good scientific evidence and try to convince them of the safety and the benefits, but we still have to respect their autonomy. Okay, right of refusal. Anyway, I think I've missed some slides somewhere, but anyway, right of refusal. Are there times when have you been working in a pharmacy where someone has refused to give someone a prescription? So can you give me an example?
Forgeries, possible forgeries.
Okay.
Abuse, early filling on prescriptions, even non-controlled, like gabapentin at times. Those things.
Like getting similar opiates from numerous prescribers.
Okay. Those are absolutely good reasons to do that. And sometimes there's laws behind it, but sometimes it may be your personal reasons why you might not fill a prescription. So anything come to mind there?
Abortion medication.
Yeah, absolutely. I'll just say Plan B, contraceptives, where it may be against your religious beliefs to not dispense those. And I'll show you a case coming up where that was the fact. So there may be times when you can refuse that. As a professional, as our APHA policies state that a pharmacist can refuse a prescription, and it's but we have court cases that aren't quite jiving with that sometimes. I don't know if any of you have listened to the APA district meetings, but last night they talked about hydroxychloroquine. That's been pretty controversial. You know, when it first came out, it said that it might be effective. People were stockpiling it. Physicians were writing for large quantities for all their friends and family when it was supposed to be only reserved for, you know, the first responders, people at risk, those kinds of things. Pharmacists were refusing to fill it. Now it's not, it doesn't jive with the CDC guidelines right now. And I will tell you, in the state capitol, just recently, Jason Rapert, who is one of our state senators, got COVID and was in the hospital, and he wanted to get hydroxychloroquine. And they were, I don't say they refused, but he got remdesivir, which is probably better, you know, but he wanted hydroxychloroquine, and he was saying that they refused. I don't think sometimes pharmacies in some of the larger chains have a policy that says they're not going to give hydroxychloroquine. You can fill it. There's nothing that says you can't fill it, but sometimes that there's policies that are in play that may contradict a patient-physician relationship. So those are controversial right now. Another one would be patient safety, that corresponding responsibility. Say you get a prescription for someone for narcotics, for opioids that are excessively high, and you think that they may be at risk of overdose. Or it could be a dose that's too high for a pediatric patient. Or it could be anything that you think is not in a safe, best interest of the patient. So, yes, you had a question.
I was actually just going to tell you, I thought of another, we were literally talking about this, and sometimes whenever they're given an antibiotic and they're on like Celexa or something like that, the pharmacist will refuse to fill it without the doctor's consent. So that's kind of along the same lines of what you're doing right here, like what we're talking about, right?
Yeah, but sometimes even you might check on it and have to get the doctor's consent. Sometimes you'll get you'll call and you get a message from the nurse that said, that's what he filled, that's what he wanted, you know, and you go, no, this is wrong. This patient is, and if they say, no, this is what I meant, even if the physician says it and you think it will be harmful, you do have a corresponding responsibility that says, well, you know, if somebody comes in for a prescription that is obviously overdose potential or harmful, and you fill it and they have an adverse effect, you are also on the hook for that, and you can be held liable for that. So you have the responsibility and the right to refuse a prescription if you think that's the best interest of the patient. Yeah. So, okay. Oops. Okay. This was a case, we're back to the emergency plan B contraception. Owners of a pharmacy did not want to stock emergency contraception like Plan B because of religious reasons. When the patients came in for these products, the staff would direct them to the neighboring pharmacies. There's a plus and a, you know, thumbs up, thumbs down. Do you think that this was okay? You know, your right to refuse based on religious reasons. Is that okay?
I think if you're going to take that stance, that's the right way to go about it. Like, not judging them, just saying we don't personally stock that, but you can direct them to where they can find it. I think they took the right approach if you're going to make that decision.
Yeah, if there's a right next door that has it and you just say, hey, you know, it's not a big deal, you just got to go like right over there. I mean, I don't know. Personally, I don't like when businesses do things for religious reasons like that. But I mean, it's their right, I guess.
And I will tell you that the pharmacy policy will stand behind you on that. But in this case, the judge's ruling, this went to court, and the judge's ruling was that the pharmacy should have filled it. And that if you like her reasoning was if you were in a rural pharmacy where like say you're the only pharmacy in town and this is a time sensitive drug that they would have had to go to another town, a pharmacy that may not have been an option for them. And the judge ruled that the pharmacy was negligent in not filling it. So I'm not saying it's right or wrong. I'm just saying that's what happened.
So like literally counter like their choice to take this medication and their choice to go to a neighboring town. Like there's no way there wasn't a pharmacy within the day. Are those not the same thing?
They just felt like the pharmacy was putting their beliefs, they were imposing their beliefs on someone else, so I'm just saying you do have a right to refuse prescriptions, but this case the judge ruled otherwise.
Right. When you say time sensitive, that makes a lot more sense as to why they would rule that way, because it is a time sensitive drug.
It is.
Okay, but so the judge ruled that they had to stock it because time sensitivity, if we don't have it in stock, we don't have it in stock.
Well, in this case, I guess that they may have sued for damages or something. I don't know. I didn't read the whole court case, but I will tell you that one of the things about ethics is it's in the eyes of the beholder sometimes. So just pharmacy standards will back you on this, that you can refuse a prescription. But this case, the law didn't. So I'm not, there's a lot of things that aren't cut and dried as far as ethics go.
Can I just chime in? So my mom owns a small business and she's a veterinarian. So she kind of has to deal with this kind of thing too, not on a religious perspective because she's taking care of animals. But growing up in a business environment, I think the one thing people have to realize is that patients have rights, but so do businesses, and nothing's going to be black and white. You're going to come across this every single day, and you have to be you'd be well versed in the details of what everyone is allowed and not allowed to do. So just because, and I don't particularly agree with this either, I don't really care about contraceptives. I think they're okay, but it's like you can't have freedom with what you want to do and also be told by the government what to do.
And it's days and time. This is not healthcare, but I know right now, different businesses are saying you can't come in without wearing a face mask, and that's their right as a business to do that. And some people don't, want to wear one and said it's their freedom. I'm like, well, it's their business. They can decide who can come in and not come in. But then you have on the other hand where people wouldn't sell wedding cakes to someone that they didn't agree with their choices for a partner. And so it is difficult these days or anytime, just to where do you draw the line? And so it's one of the, and probably in some of that we have to, and I'll get to the ethical decision making part of it, but I'm bringing you another case. I'll let you read through this. It takes a little bit of time. I want you to basically, there's someone suspected of stealing narcotics, but I'll let you read through it. One, I'll also ask you, the dilemma is what do you do if you suspect someone that might be stealing narcotics? You could be the pharmacist, and and you find that your technician may have done that. Or let me ask you another question too. There was a case where a pharmacist, I'll say the technician stole the narcotics from a pharmacy. The pharmacist was totally unaware of it, but they were held responsible. Does that seem fair to you?
Yes, because it's their responsibility to keep up with the books.
Okay.
So if you weren't like keeping up with it and didn't see it right away, then it is their responsibility if it's been happening for a long time.
I think sometimes if it was just one bottle and disappeared and you didn't catch it, that would be one thing. I will tell you, in that case where I told you the pharmacists were held responsible, they stole over 200,000 doses of narcotics. 200,000. And the pharmacist never knew it. The technician he would order like 6 bottles, and he would put 3 in the storage room and then sneak them out to his car and put 3 on the shelf. The pharmacist totally trusted the technician and never checked the books, did not know it was going on. And that is totally negligent. It is. So in that case, if it was one bottle and disappeared, I'm sure that it would be a different situation. When it's 200,000, that's negligence. So, and it happens, and it's we have to be vigilant on those kinds of things and respond and take responsibility as well. So
on that case specifically, was it a small community pharmacy, do you remember, or a corporate chain pharmacy?
I don't recall, but I will send you, see if I can find that. I can send it to you.
Because I'm like, you're going, how do you not see that money's gone? But from working in a chain pharmacy, you don't really see the money. They see the money, and they're like, no, you can't order anymore, But at a community pharmacy, I just can't imagine not realizing that kind of money is leaving your building.
Yes, you're just not paying attention for sure. But I'll have to find, I can't remember what type of pharmacy it was, but it did go on, and the pharmacist was held responsible, as they really should have, things. There'll be times when, the New England Compounding Center, when the pharmacy was not adhering to standards of practice in terms of cleanliness, and they dispensed thousands of doses of compounded steroid injections that were used, and like 70 patients ended up dying from sepsis from the contaminated products. It totally changed sterile compounding practices in the United States. I cuss them every day for having to they've changed the way, like nuclear pharmacists practice. We have sterile compounding, and it used to be, they've just taken it to the nth degree, and it came down from legislation from that event that happened. Some of the changes, I'm sure, were good. Sometimes I think they were overkill, but those pharmacists were totally negligent, and they were brought up on criminal charges, not just professional charges. So yes, they will be doing time in prison for their negligence. But when you do ethical decision making, there is a kind of a framework to follow. Identify the issues and examine the facts. Like if the decision, are our narcotics missing? Who could have been responsible? Finding out some more information. Then you apply the standards and guidelines. Is it okay to look the other way? Is it not? What are the standards say? What are the laws say? Evaluate the possible solutions that you might have. You may have 3 different scenarios where I could do A, B, or C. Document and implement your decision. I will say, a lot of times, pharmacists or anybody, you need to document your information and why you made that decision, because then you can say that there was a logical process to it. You may not have come up with the right decision, but at least you can say this is the decision-making process that I followed. And of course, then you can always look back at, reflect on it, and decide if it was the right decision and learn from it or not. But you should, anytime you have an ethical dilemma, you should always not just say, well, this is what I believe and or what I think, and just act on it. You should really, when it's ethical decision making, there's always two sides and people evaluate it differently. So you may need to get more information. What do other people think? What's the right thing to do? Call the State Board of Pharmacy. What do they think? You know, back up your decision with guidelines, standards, and facts, and and document that, and that will help you make the right decision. Anyway, we're almost out of time. I'm going to leave it open for questions. Well, I'll go ahead. I'm just going to play the oath of a pharmacist, because sometimes you don't ever hear the oath of a pharmacist until you're a senior graduating. But I want to I wanted to play that for you beforehand. But before we do that, what questions do you have for me, or for a situation that you've come across? Does anybody have any questions? Then come up.
I have plenty, but they're nuclear, not ethics. So I'm not gonna do that for email.
Well,
later.
we'll take those offline. That's fine.
Yeah.
You're welcome to contact me. We can have a Zoom call for that too.
Thank you so much.
What about, like, this is kind of another scenario. What about providing, like, the prisons with the drugs for the inmates on death row, like for executions? That's a big one.
That is a great question. That is an ethical dilemma. I will tell you, I was in the APHA board of the House of Delegates when this issue came up as a policy. We were expecting a lively discussion on this. They drafted the policy. They looked through it had all the background information. It was not controversial at all. Basically, the APHA House of Delegates, which represents all of pharmacy practice, the policy is pharmacists should not participate in death row administration of drugs. It goes against what we think in terms of what's best for a human. The policy from the House is that we don't think pharmacists should participate. That doesn't mean that pharmacists can't decide on their own what to do if they want to participate in administration of lethal medications. They could do that. But as a House of Delegates, as a profession, we have said that that goes against what we believe in health and safety of a patient. And it's one of the things about, there are policies on the books for things like this, because like when a APHA gets calls all the time from news media, it says, what do you think about, whatever the current issue is, like death row or things like that. And so if we don't have policy on the books, we cannot speak for the profession and say, this is what we believe. But when there's policy on the books, we can say, this is our stance. This is what we believe. So every year the House of Delegates takes up new topics and we review old policy, and it represents the whole profession. And it's a great experience if you ever get a chance to be a delegate. What you can be a delegate in the House of Delegates. We're always looking for delegates. There's about 400 or so delegates each year, and it's a great experience. And so they set the policies. Sometimes it's like we're opposed to, or we support education for naloxone, or some things aren't very controversial. It just says we do support this or we're against this. Most of it they write in the affirmative, but it's one of, if you want to read through the policies, you can say this is what we believe as a profession. Any other ethical decision making? Okay. I'm going to go ahead and play the oath of a pharmacist. If you have any questions, don't hesitate to reach out to me. I'm going to escape this and play. Oh.
Please raise your right hand.
Can you hear?
Recite the oath of a pharmacist.
I promise to devote myself to a lifetime of service to others through the profession of pharmacy. In fulfilling this vow,
I will consider the welfare of humanity and relieve the suffering my primary concern.
I will apply my knowledge, experience, and skills to the best of my ability to assure optimal outcomes for my patients.
I will respect and protect all personal and health information entrusted to me.
I will accept the lifelong obligation to improve my professional knowledge and competence.
I will hold myself and my colleagues to the highest principles of our profession's moral, ethical, and legal conduct.
I will embrace and advocate changes that improve patient care.
I will utilize my knowledge, skills, experiences, and values to prepare the next generation of pharmacists.
I take these vows voluntarily with the full realization of the responsibility with which I am entrusted by the public.
Okay. So anyway, I can't cover everything you need to know about professional ethics, in a short amount of time, but I wanted to, it's something just to think about. What is the right thing to do for the patient? What is in their best interest? I realized I skipped over the question about sometimes it's like, which should you make money or should you give them the lower prescription costs? So there's a lot of things that every day that you run across that are ethical decisions. And if you follow the principles of the core principles of ethics, then hopefully you will make the right decisions. Go through the process. What is the right decision? Gather the facts. Look for other collaborating evidence from other professionals. What would they do? Those kinds of things. And hopefully on a day-to-day basis, you'll make those decisions that will benefit the patient. So I'll turn it over to Dr. White.
Thank you so much, Dr. Hilliard. I get chills every time.
Are you on mute?
Oh, no, I don't think so. Can you guys hear me? Is that better? Okay.
No.
So I get chills every time I hear the oath of a pharmacist. When you really think about those words and take them into account in those words that you recite, you guys will recite that at your honors convocation in your 4th year. And it's serious when you really think through those words and what you're agreeing openly to do. And so thank you for playing that. I was like, she's gonna play the oath, oh my goodness. And so anyway, thank you guys for your questions, for being interactive, for asking questions, for bringing up tough subjects. I appreciate it. I hope you have a great day and a great weekend. Check your emails. The nominating process for your class officers is officially open. If you don't have that, because I got a couple of emails that bounced back, it means it's time to clean out that email because you are not getting emails from anyone. So make sure that you guys have that. If you don't, clean up that email box and you'll free up some space to receive more emails. Thank you again, Dr. Hilliard. We appreciate you being here. Thanks, guys. Have a great rest of the day, a good weekend. Find some time at some point to do something fun that is not studying this weekend. Give yourself at least a half hour to an hour of downtime this weekend. That is your homework for career orientation for the weekend, and have a good day. I'll see you guys on Monday. Bye.
Have a good weekend.
Jeff, $9. Oh my God. You're gonna kill me. Oh my goodness. 9 to 10 hours, huh, Jeff? 9 to 12 hours. Have a good day, guys. Bye.